Pulse oximetry is a method that allows responders to quickly measure how much oxygen the blood is carrying. It can be helpful as part of a comprehensive assessment in determining when emergency oxygen may be appropriate and in monitoring its effectiveness. Typical pulse oximetry equipment is inexpensive, non-invasive, and user-friendly. The measuring device usually clips onto a fingertip or an earlobe, as these are fairly translucent parts of the body. Assess the person. Activate the pulse oximeter. Apply it to the person's finger or earlobe. Allow time for the unit to measure and check the results. The system uses both red and infrared light to measure the peripheral oxygen saturation of hemoglobin, expressed as SpO2. Pulse oximeters, as the name implies, also measure the pulse or heart rate. Pulse oximeters are fairly accurate, generally to within plus or minus 2%. Pulse oximetry should not be the only method used to assess and determine the need for emergency oxygen in a person with outward signs of respiratory distress, nor should it be used to withhold administration of emergency oxygen. An SpO2 level of 95% or higher is considered to be normal. A reading of 93 to 94% may indicate mild hypoxemia or low oxygen, and a level of 92% or less at sea level indicates a need for emergency oxygen. The oximetry reading may be less accurate if the ill or injured person is wearing nail polish or has artificial nails, has poor circulation, or has been exposed to the cold or is hypothermic. Also affecting the accuracy of the oximetry reading: excessive movement, lower blood pressure, shock or hypoperfusion, and a poor-fitting sensor. Since pulse oximetry equipment cannot distinguish between oxygen and carbon monoxide, victims of carbon monoxide poisoning or smokers may have inaccurate or higher readings than their actual oxygen saturation. Some individuals with severe chronic lung disease, such as chronic obstructive pulmonary disease, or COPD, may develop a condition that results in excessive carbon dioxide in the blood. This can occur if they are provided too high a concentration of oxygen to bring their SpO2 levels above 95%. These individuals will most likely need targeted saturation levels of approximately 88 to 92%. Pulse oximetry is increasingly being used in the management of acute and chronic respiratory disease and can be used to monitor the effectiveness of emergency oxygen for a person in respiratory distress.